Hello and welcome to the Common Good Data Podcast. My name is Drew Reynolds. Housing has gotten a lot of attention recently. It was a big theme in our most recent national elections and is becoming an increasing challenge and burden for individuals. We know that the cost for home ownership and buying a home has really skyrocketed in the last couple of years. The ability to find a stable place to live that's affordable and that works for your household or your family is becoming increasingly difficult. And we're finding that housing is a huge challenge, not just because it affects people's sense of identity, their sense of dignity. It also impacts their health and their well-being. And so we wanted to have a conversation on that on the podcast today. And to do that, we've invited Jeffrey Smythe, who's the executive director of the Atlanta Regional Collaborative for Health Improvement, or also known as ARCHI. And I wanted to talk with Jeff really about a fascinating initiative that he's been undertaking at ARCHI that uses technology to streamline the way that people seek rental assistance here in Atlanta. It's a really great conversation, especially for those of you nonprofit leaders out there who are looking to find ways to build strong partnerships and integrate data and systems across many different organizations. Knowing that that's a huge challenge, I think that Jeff's wisdom can be really helpful as you're thinking through some of those challenges in the organizations in which you work. Jeff is also great because he's just a wonderful nonprofit leader. He's been in leadership in some capacity for some 30 years, working in housing, homelessness, hunger alleviation, aging services, international development, refugee and foster care and support. You name it, he's probably done it. So I think he's going to be a great person to help us think about this conversation around the connections between housing and health. Now, before we begin with the interview, I do want to ask you a favor. Please do head over to Apple Podcasts and post a review of the Common Good Data podcast. That goes a long way in helping us to continue to build our podcast and reach new audiences. If you're listening on YouTube, please do like and subscribe so you can follow along with us as well. Now, without further ado, let's go ahead and dive into the interview with Jeff Smythe. Jeff Smythe, welcome to the Common Good Data podcast.
Great to be with you. Thank you.
All right. So I'm so thrilled to have you on to talk a little bit about housing and health and everything in between. And I know that we've had chances to connect in other spaces, but just so thrilled to talk about it today. I love Matthew Desmond's book, Evicted, which highlights how housing and instability, eviction kind of traps families in cycles of poverty and hardship. And you know, that book, I think, had me so much thinking differently about the experiences that individuals and families have today around housing and homelessness. And can you talk about, maybe from your perspective, what are some of those key challenges that families who are in this cycle are facing?
Yeah, thank you, Drew. And thank you for shedding light on this. I think that, we had a discussion last week with just recently, like with folks who have experienced or are experiencing evictions recently or just, folks who have experienced housing insecurity in the last couple of years. And just to kind of, get a perspective on what is, where their head's at, right? And kind of what's going on for them. And for them, I think what we heard is what you also see in this book is Georgia has a lot of, may I say, protections for landlords. And so something like asking tenants to come up with 3 times the amount of rent to get into a place can be really difficult. In fact, impossible for many folks who, maybe have poor credit now, or they're trying to dig out. Maybe they've experienced homelessness and are now back on their feet, but find it really hard to just get into a place initially. So that 3 times the rent was a reminder to me last week in discussions of how many folks are really that we've made it really difficult, not only to find housing, but then to get in it and stay in it. I think that what we see in terms of cycles, what from my experience, particularly working with people experiencing homelessness now, working on kind of systems change and kind of homelessness, housing, healthcare. In my experience too, just listening and kind of listening to all of our case managers and those who are kind of in working with large groups of people experiencing homelessness or on the verge of. I think that we being able to kind of build wealth, being able to, what they say is it's expensive to be homeless, right? It's expensive to be poor. And so, the deposits that are needed, the, co-signing, that's needed, the just, to be able to get your utilities turned back on if they've been turned off, to be able to get into housing, to be able to kind of manage, childcare costs. And so even if I'm looking for a job, how do I get some of these costs covered so that I can truly do a good job of looking for a job? That's really challenging, for families. And so I think that we see some of these cycles repeating themselves because there's not been kind of changes to the way we do things in Georgia that makes things that kind of shifts that burden at all. It makes it, it still puts the burden on the seeker of housing, on the seeker of rental assistance, et cetera.
I love that phrase that you used, it's expensive to be poor. And I think for those in the helping professions, they might be familiar with the term or maybe have not heard before, but it really highlights how these systemic inequalities and financial barriers, like you mentioned, the 3 times the rent you need to get into a place, really makes life disproportionately costly for folks who are on the lower incomes. When you kind of have your systems in place, all of a sudden you can save money on different things. You're not having overdraft fees on your checking account that just got overdrafted. So those different ways that what systems kind of put those pressures on, I think you highlighted that really, really well. So let's bring it here to Atlanta. I know we talked a little bit about, Georgia and kind of different laws that we have around systems that maybe will protect and do a little bit more to protect landlords maybe than tenants or those who are seeking places to live. But maybe can you talk a little bit about kind of what does it look like to be in that kind of circumstance? Like what are the people that you interact with, you and the organizations you work with? What does it look like, to be in that situation?
Yeah. So we can, when we study the numbers and just what data we can pull, right? There's a lot of data we'd like to be able to pull. But we, whether it's census data or eviction data, it's not necessarily set up to be able to kind of slice and dice as much as we like. But what we do know, particularly from, what's called the point of time, count, which is kind of the annual HUD's way of getting at least some sense of a homeless count in each kind of county or geography per year. What we know from that is that we have seen it increase. What we also know is that we continue to see very high numbers of Black and brown population, particularly Black population in Atlanta. When we look at eviction rates, particularly when we compare it to other rates like healthcare rates, like certainly, higher blood pressure rates, higher diabetes, premature death, we see the same heat maps, right? So those same communities that are having poorer health outcomes are also seeing greater housing insecurity, more challenging, more challenges around evictions, et cetera. We also see larger families are many times harder to serve when it comes to evictions. Folks who have had repeated issues with evictions are harder to serve, and it makes sense, right? When we think about funders, government entities, even just kind of local philanthropy, oftentimes our grantors don't, they, for good reason, they don't want to see funds going to those who have had kind of repeated situations. So it does make it harder if you've had repeated situation to be able to be served. Interestingly, for the portal that ARCHI has worked on, which has seen more than 30,000 folks apply for rental assistance through this portal over the last about 20 months. The other population that we see that's I shouldn't say it this way. What I want to say is what we actually see is that the vast majority of folks seeking rental assistance currently or over this last 20-month period actually did not have repeated evictions. It was actually more than 70% had this was the first time they were facing an eviction or kind of housing insecurity. So that's promising, except for the fact that then when we look at those who are actually served, right? So more than 30,000 had applied for assistance, at least through the portal that we operate, which matches folks when they're seeking services to those nonprofits that are able to serve them, tries to cut back on all of that burden of going from organization to organization. We can talk about that in a minute, but
Yeah.
that what we saw from that is that roughly 10%, less than 10% of those who are seeking assistance were able to find it anywhere, right? Even when they were matched, even when they were, there was just far more need in the system than there are resources.
Yeah. Well, it speaks to just the incredible challenge, and also just the large amount, like 30,000, individuals seeking assistance through the system is really a huge number. We have in our culture an assumption around what homelessness looks like, and it often involves somebody who has significant mental health challenges, somebody who is unhoused and living on the street outside of other places where they might be seeking shelter. It's often somebody who's individual and male, right? But when you talk about housing and homelessness, and especially when you're thinking about families who are experiencing an eviction for the first time, all of a sudden the sort of the profile of what someone might think experience is really quite much more broad and much more expansive and representative of really the large challenge that this represents across our community. But I want to talk a little bit. You mentioned ARCHI, so let's talk a little bit about kind of that what ARCHI does and how it is able to connect folks. Can you talk about that a little bit more?
Yeah. So why is a health collaborative thinking so much about evictions, right? So the ARCHI is a health collaborative. It stands for the Atlanta Regional Collaborative for Health Improvement, and this was a group of health systems, Georgia State University, United Way, Kaiser Permanente, a lot of groups that came together, Atlanta Regional Commission, et cetera, that came together about 12 years ago and said, how do we move the needle? Like, we're seeing that our health disparities are getting worse in Atlanta. Our health outcomes are getting worse in Atlanta, and yet we're pouring more and more money into healthcare. Something today around $13 billion a year, in the metro area in healthcare. And yet we have some of the poorest health outcomes in the country. And so what ARCHI has been designed to do is to try to make that collective impact, right? To try to take all of those organizations that are interested in working together and to collaboratively move the needle, like find where our best levers, where are our best pressure points, and how can we move the needle together. And of course, what we have found is that we can do a ton of work around prevention, but when we think about those social determinants of health, right? Those things that make folks that contribute to either making us be able to get healthier faster or get sicker or kind of stay with our chronic conditions longer and not get healthier. Those social determinants are really important, right? Where do we live? What kind of air are we breathing? Access to water, access to sidewalks, access to healthcare, access to childcare, et cetera. So those social determinants are where we've been leaning in. We, of course, leaned in on evictions and found that there was a lot of families that were having to spend a lot of their time just kind of going from organization to organization. We tested and found about 20 hours if you're facing eviction, you're spending about 20 hours of your time to try to go from organization to organization, kind of retell your story, resubmit all your paperwork, oftentimes to find out that you weren't in the right zip code. They didn't have funding right now. They were only serving veterans. They were only serving families with small children, whatever. Mm-hmm. So what we try to do is just say like, hey, nonprofits, are you open to kind of collaborating together, working on technology together and kind of setting up this portal? And so that's been very effective, right? Like I said, more than 30,000 folks have now come through the portal to seek assistance from one of these now 18 different organizations that have come together. It's not perfect because, of course, what we found is that even though it's really dramatically lessening the burden for those who are able to be served and get matched quickly, there's a lot of folks that never get matched because there's just not enough resource in the system. It's not that they're not being matched because, they've had too many evictions in the past or they don't meet the profile of the nonprofit. What we're learning from nonprofits is they have, for every 3 folks they can serve, there's, roughly, I would say 30 or more at that moment in time that they can't serve just because they don't have resources. Meaning people will qualify, They just don't have enough funding, enough grant, philanthropic government subsidy to distribute. So that's what ARCHI's been up to is can we coordinate systems better? Can we collaborate better? Can we leverage technology in a way that kind of limits the burden to the seeker, but also limits the burden to the organizations providing assistance because we know they don't have as much capacity. I came from one that was doing this work and we didn't have any capacity. So we can just shift some of that burden from all of that intake and eligibility process to be able to do better case management and just support clients in their time of need even better. We think that that's a better way to go. So it's proving successful. We're able to see, good progress. But what we're also able to see now is that there's dramatically not enough subsidy in the system altogether. So that's the next phase. What do we do about that?
Right. Yeah. But it's so important though to be able to use that information to reveal those challenges.
Right.
We might not have had that information when you have to go. Not only does the seeker of assistance need to go through a bunch of systems, but if you wanted to find out, across a region, across the Atlanta metro area, do we have enough resources for this problem? It would have probably been hard to answer that question prior to the development of this tool.
You're right.
So
you're right.
You've developed this tool, and really a key component of it is this notion around data sharing. And you and I got a chance to talk a little bit about this before we recorded today. But I'd love to talk a little bit about how you've approached that, because I know that there can be some reticence sometimes and some concern among nonprofit leaders when it comes up to data sharing around issues of privacy and confidentiality, and then also making things just work, for their own staff so they don't feel like they're in 7 different systems filling out, forms all the time. So can you just talk about what did you learn in the process of developing ARCHI and how that's really benefited the organizations who are participating in it?
Yeah, thank you, Joe. I mean, our vision is that we have an interoperable way to share data across nonprofits that are serving folks in their time of need, but that this same system would be able to talk to the health systems, right? Because we know that a healthcare system is going to be able to provide better care if they know that the person that has come in through their emergency department has been seen recently by, let's say, Open Hand. And so they're eligible for meals, or maybe they were served recently by Star C. And so they've been able to work on a housing plan. So we think that kind of interconnectedness, that interoperability is going to be super important. We're not there yet. But what we did learn in getting these 18 organizations to the table to collaborate together is that we had to keep it simple, right?
Right.
We had to be able to make sure that whatever technology was used, in this case, we used Salesforce, that Salesforce was going to be able to speak, to talk back and forth to their systems. So in some cases, we had to do APIs. In other cases, we've had to do upload download, which of course is not ideal. No one wants to do upload download. But at least it is an option for some nonprofits that are saying, I'm already loving this software. I don't want to reinvent the wheel. I just want to receive your referral, and then I'm going to take it from there and get it embedded into my system. So it tries to give the nonprofit enough to say this person is a good match for you, but not so much that then they're going to have to do a bunch of additional data entry. Does that make sense?
Oh, absolutely. Yeah.
And we've tried to really hone that. If there's continual process improvement meetings about twice a month, really, with different kind of cohorts of these 18 organizations, sometimes with a small group, sometimes with a large group, but over, basically twice a month, give or take, we're trying to work, and we work with TechBridge, who is our technology provider, to really hone in on what's not working well. If you're not adopting it, why? Because what we don't want is for it to be one of those systems where it just becomes useless, right? I'm either having to do double data entry, or it's so complicated, I can't get what I need out of it. And so I'm not even going to use your system, ARCHI. I'm just going to do my own thing. So that's what it's kind of required all these organizations to continue to think out loud together, to continue to hone, like, how do we do this better? They were helping us kind of reword the communication that goes to the seeker of services, right? So that it says what we all want to say better, right? So that's how micro we've gotten. Also, it requires the nonprofits to once a week to say, yes, I can take how many slots, and no, I can't. So rather than it being just this kind of open, at one point in time, this nonprofit could take people, but 3 weeks later they couldn't because their funding changed. This requires them every week to update their like how many people they can take and are they in or out. That way, where they're not getting, we're kind of eliminating that kind of useless, like a bunch of referrals that don't go anywhere. So those are the kinds of things that we had to do. Those are some learnings that we had to do to make sure it worked. The other thing is just continuing to ask the advice of those who are using it every day to just say, what do you see is going well? We've also had the seekers of rental assistance, seekers of utility assistance to make sure that they're continuing to advise on, don't forget, this was a total dead end to me. Like this made it worse for, like we just want to make sure we're continuing to get their experience in. And so what we've had to do is also just do a little bit of fundraising for our own kind of time to get some consulting help, to get some technology help, and try to make sure that burden is not on all these awesome nonprofits doing the hard work. So we see that as part of ARCHI's responsibility, just to try to help. If we want them to collaborate, we want to make sure it's as easy as possible and that it's as responsive of a system as possible.
Yeah. One challenge that comes up a lot with data sharing too, particularly when you're sharing information between organizations for the purpose of, connecting somebody, making a referral, delivering some type of service, is finding out a really efficient way to find out, well, was the person served?
Right.
And so you mentioned at the beginning that you knew you had a ton of people who were applying for rental assistance, but only 10%, received assistance. So how did you go about finding that out? And when someone goes in and a referral was made, how does the system able to tell whether or not that person's been served?
Yeah, that's a good question. We're actually trying to refine that, to be honest with you. So what we can track in the system is when a case manager, for instance, says, I'm accepting this match that the portal's giving me. And then when the case manager also says, and this person has now received assistance, there's a gap there. And we're trying to figure out why sometimes the case manager will say, I've accepted this person. They meet our criteria. We meet theirs. But then we don't get that closed loop of like, this person was served. We're trying to figure out why, right? Is it just the case manager is so busy and they forgot to like go back in and click and say, yes, this person got it? Is it that something happened with the person seeking services that they were non-responsive or didn't follow up or ended up having additional eligibility criteria that didn't work? So we're trying to figure out what's this gap between kind of matched and served. We think that more folks have been served than we're actually getting that closed loop confirmation on. But we're trying to kind of hone in on that and figure out like, hey, case managers, why are we seeing it this way? So yeah, I mean, the technology is built to have that and to ask the case managers to make sure that they are kind of updating that. What we're learning though is that there's still perhaps some gaps in terms of just making that happen, right? And kind of, checking all the boxes.
Mm-hmm. When you first pitched this, and I want to get back to some health questions in a minute too, but to follow up on the partnership as you're developing it, what was it that got the 18 members to say, yeah, I want to do this? Like what was their interest and their motivation for being able to, outside of the fact that it would be benefit to everybody, but it could also, weighing their sort of the burdens and their abilities and the capacity to take it on?
Yeah. I would point to some tremendous leadership, right? Like there was 3 organizations in particular that kind of early on said, yeah, we're in. And even within those organizations, there was a case manager supervisor or 2 that basically said, this is completely not making sense. I'm tired of this kind of referral carousel, and I am going to personally get involved and make sure that this is better, right? So it really took some leadership. It took their leaders, right? Their executive directors and CEOs saying, yeah, we want you to take the time to do this, because it's not like they're getting, and the reward they're getting is just knowing that they're making the system better and serving families better. But, oftentimes that for many other organizations, that wasn't kind of like in the cards at the moment. Like they just couldn't put that together. So some early adopters who would really lean in, really help us perfect things. And then as that took, as it got momentum, then being able to share with other nonprofits, yes, it's working. Yes, it's working. I will say a big game changer for us as well is the city of Atlanta. The mayor's office also took note of this work the mayor had also been kind of tracking, really ridiculous eviction rates, but also was aware that at one point previous to this administration that we in Atlanta had to give back money to the federal government for unused rental assistance. And no one wanted that again. That's part of the reason why ARCHI kind of did what it did, because we said, this is ridiculous. So same thing with the mayor's office. The mayor's office said, hey, our new housing help center, we want to make sure that all of this work leverages the portal, the ARCHI portal, as much as possible. And that helped as well, right? Because then when you get government friends involved, oftentimes they will say to the nonprofits they work with, hey, you got to do your work with ARCHI. You got to do your work collaboratively. Mm-hmm. So having some government partners to be able to kind of, it's not really a carrot or a stick, but just to be able to say, hey, we think this is the right way to go, that helped as well. So that kind of led to more and more organizations. And we still have, we would like to double that. When you think about Metro Atlanta, about all the wonderful organizations that are doing this kind of work on utility or rent assistance, even mortgage assistance, we've identified additional organizations that we're continue to work on to say, hey, how can we, what are the obstacles to you leveraging this portal? And what we found even is some organizations, they don't even really have a good CRM, right? Like they need the portal to be able to do some just kind of basic client management pieces as well. So we have built that in as well and that was also thanks to the City of Atlanta Housing Help Center. Like, how do we build in some basic CRM capabilities so that really, small nonprofits that are doing great work can leverage this technology to also just do their kind of basic client management.
Yeah. What a great example. I love that, between having early adopters and a couple of champions early on, along with having that governmental support that adds a little bit more of a, hey, this is how we as a community want to move forward, is so critical in being able to bring a bunch of different organizations and groups on board. Let's take a step back, to a conversation we were having previously on the connection between housing and health. And so we know that, evictions, that housing instability and homelessness is related to a whole sort of suite of negative health outcomes, from chronic stress to increased risk for illness and whatnot. But can you just talk a little bit about what you're seeing at ARCHI and like how that connection is coming out and being kind of displayed in your work?
Sure. Yeah. So we know that there's mountains of evidence now in terms of just the impact of becoming unhoused on health, right? As you said, the chronic stress, the how it impacts just even being able to think about any kind of health needs. If I'm diabetic and I need my insulin refrigerated and I'm unhoused, I'm going to be having major issues with my diabetes, right? There's just no way to get better health outcomes if we also are not thinking about housing along the way. If not that housing is actually got to be like at the center and be kind of a primary thought.
Right.
We know that, not all social determinants are created equal, but it appears as though there's, kind of growing evidence that housing really is one of those that you've got to get right if you want to see better health outcomes. And so as we've studied kind of unhoused health outcomes, we can see that, pretty much along the line, you're you have much better health outcomes if you're stably housed, if you're not experiencing any housing insecurity. And, that's obvious, right? That we all get that, right? Like we'd have better health outcomes. But ARCHI continues to really work with health systems and say, okay, how do we continue to make sure that housing is a part of what you're thinking about? There's a wonderful group that Dr. Mark Holtzberg has stood up in town that has been really looking at, is there a way for health systems to actually be pooling together to actually support some housing, as they're seeing some folks that are cycling in and out of their emergency departments over and over again, who are also fragilely housed. Is there an incentive for health systems to be actually thinking about, is there housing they could stand up? Great examples of health systems across hospitals and health systems across the country who have done that, right? Mass General in Massachusetts. There's a group in Utah that's done some really great work in Baltimore and Chicago. So we're starting to see health systems say, like, what should we be doing in housing? In Georgia, in Atlanta, what we've seen is Mercy Care, interestingly enough, a federally qualified health center, not a big hospital system, but a smaller federally qualified health center. They've just stood up some housing in Old Fourth Ward, Atlanta, and that is designed specifically, again, to kind of add capacity to primarily unhoused or fragilely housed population who also have chronic conditions, right? So we're seeing some opportunity there for health systems. Can ARCHI or any other entity just help the health systems be able to think about their strategies? Kaiser Permanente's done some great work on this. CareSource has done some great work on this. So we're seeing some great local examples that it's starting to kind of catch fire, that there's some interest that, like, yeah, we're going to see better, lower ER utilization and better kind of patient outcomes if we can also just be thinking about housing. We get that, like, it's not that a health system can spend all of their resources on housing. We get that they've got to do healthcare really well, and that's harder to do now than it was before COVID, particularly with kind of workforce challenges. But we also are seeing just tremendous results. Hospitals and health systems are seeing better health outcomes when they're able to add a housing strategy to their portfolio.
Yeah. Well, I think that's really interesting. And when you were alluding to some of the other cities, I had read some research and examples of states or healthcare organizations who would even go to the extent of, to use colloquial language, writing a prescription to go get assistance for housing assistance, and how even just that phrase itself, I think, sometimes changes the public perception about what housing, really could be or be involved with. So, as you're thinking and seeing this happen in healthcare in Atlanta, have there been examples? You gave the example of Mercy Care. What does that look like? Are they sort of like in that, is the conversation around housing come up in the client and provider relationship, kind of, or what does that look like?
Absolutely. Yeah. Actually, all of the health systems are now doing what's called social determinant screenings. So they're asking about housing. They're asking about food. They're asking, when's the last time you had a healthy meal? Like, do you have access to fresh vegetables? Do you have access to transportation? Do you have access to childcare? They're asking those questions now with their patients, not just their emergency room patients who may appear to be unhoused, right? They're asking all, right? So that's part of a requirement from Centers for Medicare and Medicaid. And through that screening, they find out about housing, right? Are you housing insecure? Have you had trouble paying rent in the last, year? If you have a mortgage, have you had trouble paying mortgage, et cetera? And so, what we're seeing is that there's more of an opening up for health systems and primary care providers, any kind of providers, to just make sure that they're adding those questions in. We recently had a convening we called State of Metro Atlanta Health, and one of our steering committee members, who's a physician, talked about her experience as she was treating a patient, and how she continued to be kind of puzzled by some of her patient's health outcomes not improving, and finally I believe it was a nurse that just said, like, have you asked her about her housing? And it would just kind of opened up this physician's eyes to, like, I didn't even ask. I just assumed that it was like kind of non-compliance, or that something was going on that she wasn't telling us. And when it turned out, like, she was housing insecure and couldn't, and that was a huge obstacle for that patient being able to kind of do anything about her health needs. So, we just continue to try to make sure that there's places for health systems, federally qualified health centers, local clinics, et cetera, primary care physicians, specialists, you name it, to be thinking about those social determinants needs that often impact health much more than, compliance or medication, or even, what beds are located in what parts of the city. That's important too. But what we know that is just vitally important is these social determinants.
Yeah, Thank you so much for sharing that. And I think helping to understand just the whole complex array of things that interact and affect a person's health can be so important. For folks, not just who are doing direct service work, who are noticed and aware, but I think for the general public to be aware and to see that there's that changing perception around the connections between our health and so many other facets and aspects of our lives. So, well, I want to be respectful of your time. And so I think this is a good place to conclude. Jeff, for folks who want to learn more about ARCHI's work, for an organization who wants to get connected with the portal that you guys have developed, where can they find more information about that?
Yeah, our website is ARCHI Collaborative. I know collaborative is part of part of the name of ARCHI, but our website's archicollaborative.org. ARCHI is ARCHI, collaborative.org. And on there, when you go to resources, folks can find the rental assistance portal. But you can also see the list of more than 120 organizations now that make up ARCHI. We are an organization of organizations. We work very hard to try to carry kind of the collective movement of the group to try to get better health outcomes, better health equity across Atlanta. And so if folks are interested in joining as a partner, it's free. If folks are interested in the rent, mortgage, utility, we also have something we call community resource hubs that kind of leans in with different health systems to try to help them focus on populations that have been traditionally outside of kind of opportunity for good health and usually cycling in and out of the emergency room. We've got a hypertension initiative. We've got kind of regular quarterly convenings that folks are open to the public. So lots of ways to plug in and to learn more and just be a part of this movement toward better health outcomes in Atlanta.
Awesome. Well, Jeff, thank you so much for joining us today.